If there's one model that the world can learn from India, it is this. We have built one of the largest welfare delivery systems, but it is no time to rest. We have to go from scale to substance.
I don't think this is trivial. I don't think this was not intentional. Now, after having achieved such a scale, we don't need to any longer prove that we can scale our programs. Scale is important, enrollments are important, but we also need to look at outcomes.
We keep seeing these stories, certain people not being able to access what has rightfully been created for them.
About half of the women we interviewed were kind of chaperoned by someone if they wanted to withdraw their money or if they wanted to make a simple transaction. So that is what we need to change.
What would the next chapter of India as a welfare state, what should it look like?
The next chapter should be focused on growth, should be focused on resilience, should be adaptive. A lot of people think that when we talk about welfare, it's just giving money. It's not that. It's ensuring equity in the society.
Joining me today is Arshi Aadil. She is a public policy and digital governance specialist. She's also senior manager, government advisory at global consulting firm MicroSave Consulting. Hello and welcome to What India Needs podcast with me, Shutapa Paul. If there's one model that the world can learn from India, it is this. We have built one of the largest welfare delivery systems, but it is no time to rest. We have to go from scale to substance to ensure that every single person who needs welfare receives it at the right time. Joining me today is Arshi Aadil. She is a public policy and digital governance specialist. She's also senior manager, government advisory at global consulting firm MicroSave Consulting. Arshi, thank you for coming on What India Needs podcast.
Thank you so much for having me here, Shutapa.
This is a very important conversation, I think, that we're having, and at What India Needs, we want to highlight our success stories and also how we can just go from strength to strength. So let's talk about our nation's capacity and ability to build one of the largest and most successful welfare delivery systems. So the numbers that we have: National Food Security Act feeds more than 800 million people. We have Ayushman Bharat authorizing over 110 million hospitalizations. Jan Dhan has enabled a bank account to 500 million people and above. And obviously Aadhaar, DBT, all of these have done exceptional work. Now the challenge is, how do we make this better? How do we strengthen it and go from, as you've told us as well, from scale to substance? So tell us a bit about that.
Sure, thank you so much. And I think this indeed is a very important conversation that we are having today. And I'd like to say that imagine 3 decades ago, if we had told any policymaker in India that this is going to be the state of welfare delivery, where we would have the world's largest programs in terms of, as you mentioned, financial inclusion, food security, health insurance. That is the scale that we've achieved. And as you very rightly mentioned, that now is the time to look at what actually we need to go from here, which is the next stage from here. I'd like to talk about certain things that India did right to achieve what we've achieved today. And then I'll cover what is it that we think we should take
Do
ahead.
next, yeah.
Yeah. So in terms of building the scale, in terms of, I don't think that this is trivial. I don't think this was not intentional. This was very much intentional. And the progress started way back in 2008. If you see what other countries who are trying to expand their welfare delivery programs are doing, they are looking at program by program. So first, you would see that they would announce the programs and then figure out the ecosystem. But India did the exact reverse. We built the infrastructure, the architecture first. We built the foundations of digital public infrastructure, which is a public good that is based on our Aadhaar, which is the foundational identity. The payment rails around direct benefit transfer and UPI that has billions of transactions, everybody knows. And then the solid data exchanges that enable real-time data exchange interoperability, which is why so much of progress we've been able to make. And you mentioned about the largest financial inclusion program in terms of ensuring that 500 million people could have access to a bank account
Right.
through Jan Dhan Yojana. So that is the kind of investment that we did that helped us achieve this scale. The second thing, I think we did the plumbing right. It was not that we focused only on private programs, thinking of a single vendor, thinking of proprietary technologies. We built the infrastructure at one go. It took us time to achieve the feed that we have, but it was built as a public good.
Yeah.
All of the digital public infrastructure foundations that I just mentioned, they're all built on public systems and public goods. Now, after having achieved such a scale, we don't need to any longer prove that we can achieve, we can scale our programs. But there are certain things that we need to now look at is where do we go from here, which is thinking about convergence. That could be the first thing. That if you look at it, we have about 65 or 70 center sponsored schemes, and we have so many state level schemes. So schemes, programs are mushrooming, and some of them, they create confusion in the last mile because they don't know what all programs what all schemes they are eligible for.
Right.
So which is why we need to have convergence. We need to identify that if there's a woman and let's say she's pregnant, she should know everything that she's eligible for, and she doesn't need to go through the bureaucratic hurdles of applying every time through each of these programs. The system should be able to identify them where they are, and in terms of providing them all the benefits that they need. The second thing I think that would be important, we just spoke about scale. Scale is important, enrollments are important, but we also need to look at outcomes. The success doesn't stop at, sure, we have 500 million accounts, then what? We also need to look at the sustainability of these accounts. How many accounts are being used?
Right.
Right? In terms of if there are programs, I mean, I can mention so many programs where we have celebrated the scale. But what happens after we've achieved the scale?
Right.
If, let's say, we have distributed or we have near universal LPG coverage, we also need to understand how many of them, how many of the women, especially in the hinterlands of India, are using LPG on a sustainable basis. And if that is not happening, then what are the detriments?
Right.
What is happening?
So we'll go more into details.
Sure.
Because I mean, I think, with your expertise and your all the work that you've done, and I think there's a lot of deep insights which will come through. Building this scale itself was a mammoth task because we're a billion plus people. I think our population itself is our strength and also possibly one of the biggest hurdles in implementing any of this. But at the same time, we've done that, right? And we've done it very successfully. And, people all over the world look at India as a leader in creating this. But, what will it take for this shift in practice? This real from scale to substance. If you can tell us like briefly, what do you think how this shift can happen? Like, do we do it together all at once, or is this also like a foundation setting kind of thing?
This would be intentional, I would say. For each of the programs, we also need to see how can we make our programs more inclusive.
Right.
I mean, I just spoke about convergence. So from ensuring scale, now next thing is convergence. We need to ensure how an individual, how people at the last mile are able to identify the programs that are available for them, but then they are not excluded because of lack of information. Or let's say bureaucratic hurdles, or in terms of navigating through the processes. So that is the guarantee that the systems now need to give them by harmonizing, simplifying the programs, building more convergence. That could be one.
Right.
Other area I would say would be to have more adaptive social protection, more adaptive programs that respond to the shocks that people face on a daily or a monthly or whatever basis. Now you would see we are living in such unprecedented times. There's so much of migration happening all over the world, whether it's international or domestic. Within the country, I think nearly, I'm not sure of the numbers, but I think 1 out of every third person has migrated for work outside. So that is the level we have about 90% of our workforce that is informal, and a large proportion of it is migrant population. So people are migrating for work, and we face climate change related shocks on a single day. You can see the temperatures in Delhi and in the North Delhi, the heat waves, the cold waves. Very often we have floods. How do we ensure that people who are most vulnerable to facing these problems, whether it's an economic problem, whether you don't have a job, you don't have guaranteed wages, whether it's a natural problem, it is a pandemic, or it is related to climate change, how are we ensuring that we identify the people who are most vulnerable and ensuring that the system has enough safeguards to identify them, find them where they are, and providing them the benefits.
Absolutely.
So that is what we need to do next,
Yeah.
as building registries to identify people who are more vulnerable than others.
Absolutely. So, the e-Shram portal, for example,
Sure.
we have successfully registered over 30 crore informal
Yeah,
workers.
yeah.
And you're so right, because whenever there is a shock, whether it is man-made, God-made, or, wars, even LPG crisis.
Yeah.
I mean, the shift that currently we are seeing because of the LPG shortage, we see a lot of reverse migration happening also, where the at least lower strata who cannot even afford, they're going back, because they can't sustain, or they can't go through any kind of anomaly.
Yeah.
So we have this wonderful portal, e-Shram, and we've kind of identified these many workers. Now the next task is, as you said, how do you get them the relief and get them the relief
Yeah.
at the right time? So what would be like a practical way of doing that?
So e-Shram, of course, was launched in 2021. We have registered about 300 million people, informal workers, largely domestic workers, agricultural workers, construction workers. And this database is extremely very important. Now imagine when pandemic happened. So I work with MicroSave Consulting, and we did a survey with about 5,000 plus people. This was a research just to identify the state of relief that the states and the government was able to deliver. So we identified every time we had architecture ready. We had identified the people. So let's say people who are getting any kinds of benefits already, they were in the system, they were tagged. It was very easy for the government to reach them. But
Right.
if we did not have the right database, then we did not know the informal workers. e-Shram didn't exist. So we didn't know that any individual or any informal worker who was not a part of any existing programs, how do we reach them?
Right.
That despite the scale of programs that we were just talking about, we were struggling as a country to reach out to migrants, and we did launch multiple programs around it. Now the next step, we have this data. Now the next step for us is to ensure that the databases are clean. So
There's a lot of bad data can also
bad
come
data,
into,
of course.
inaccurate data can come into the
Sure.
systems.
So can you imagine your entitlements being denied only because you did not feed in the right mobile number or the right bank account number or even address, or maybe it's just a simple misspelling? It could suspend your entitlement.
Yeah.
And these are the things that we've seen, which is why building data quality is important. So sure, we have the database e-Shram existing. We need to ensure that the data quality, we are able to build that integrity.
So there'll be verifications
Yes,
that
yes.
should be done.
Verification, and then as a user must be able to see what data currently exist and should have the means to update them, and
Right.
also information that this updation is important.
Right.
Because if we talk about providing them the entitlements that exist for them, we also need to identify them where they are. We are talking about portability. So if you know, the government of India launched One Nation, One Ration Card program, through which any person, no matter which part of the country they are in, would be able to get the entitlements, food rations, in whichever part of the country they are.
Right.
It did not exist. It's such a remarkable feat. You don't miss on your entitlement just because you're moving. But progress doesn't need to stop only at food. There are multiple programs. So, if we want to make these programs more portable, and we should make them portable, we need to have that data integrity. We
Right.
need to know where these people are, so that in case we need to reach out to them, we need to provide the right kind of entitlements at the right time. That data quality would help.
Right, absolutely, because we keep seeing these stories, like, certain people not being able to access what is rightfully been created for them, but
Yeah.
over
Yeah.
technicalities, and therefore that is so important. And let us talk about your work. Let's talk about MicroSave Consulting as well, because you all have done some brilliant things. You all have worked on programs, I think, which we should all know about, and you've been advocating a shift from just in case funding to just in time delivery. And again, you all have worked very closely with government programs and strengthened them. So tell us a bit from your learnings. Pandemic, let's start with that.
Surely. I
Yeah.
think you've raised another very important point, Shutapa. When we talk about delays in payments and just in time funding, as you say, so if you try to unpack how the fund flow happens in government programs, whether these payments are made to individuals or businesses, um, there are certain stages. You need to make certain compliances for the payments to initiate, for the payments to trigger. And then there are multiple inspections, validation, checking if the receipts are correct. If
Right.
so, this is a timely process. And if you see almost every department would have some funds that are not spent and the wages that are not paid in time.
Right.
I mean, I can speak about an example. Everybody knows MG and Rega, which is now called VG proposed to be called. This is such an excellent program, but in terms of there's enough data that people have received delayed wages,
Yeah.
and that's a continuing thing. People don't receive wages when they actually need it right after the completion of work. So that is where MicroSave has realized that for the government funds to flow seamlessly, we need to adopt financial management systems, which is we also advocate and work in the digital public financial management space, which is DPFM. Through it, we advocate and we have built our own playbooks around DPFM principles, smart contracts, and just-in-time funding,
Right.
wherein we say that we need to have single source of data. We need to identify the rules that would make a payment automatic. The triggers would be automatic. So these rules need to be set. And once the work is done, we don't have to wait for the entire tranche of payment to happen. The payment would happen just in time after the completion of work, because the automatic algorithm we have put in.
Right.
So that is the kind of approach that we are doing with
That is so
DPFM.
doable because again
Yes.
the foundation has been set. I mean, we have
Yes.
the the tech know-how now.
Yes.
We have digital payments happening, so
Yes.
it's very laudatory. I'm so glad.
Yeah, and it's not just that we are doing this work in India. We are also trying to do landscape understanding and supporting different governments outside India, Nigeria, Uganda, and helping them build their payments and having more streamlined digital public financial management systems in place.
Wow, that's brilliant.
Yes.
Also, dialing back, you also mentioned convergence,
Yeah.
and a person, a citizen of the nation, is a data point in different ministries. How do you bring them together? As you said, that where's the convergence so that the person who needs that kind of help or subsidy or government support knows that they can access everything all together. And it's like a one, I don't know if we'll ever have a one point shop, but at least we can hope for the convergence. So
Sure.
what are y'all working on something there?
Yes, of course. So at this point of time, we've built multiple digital registries. We have different program databases that exist. But in terms of having a unified social registry for the welfare programs is something that we now need to build. And that would just ensure that different registries that we've built, they talk to each other.
Right.
So you don't have to add a person every time and make the person go through navigating all the steps just to be enrolled. We are doing this work in Indonesia. We have a team in Indonesia, and that's supporting the government in building a unified social registry. And this registry has all the data, whether it's welfare data, income data, decile population wise data, and the different databases would talk to each other. And then, based on the eligibility that you make, people would be identified automatically. But it doesn't stop there. We were talking about inclusion. So, when you rely a lot on technology, sometimes mistakes do happen. So, there could be a chance that a couple genuinely eligible beneficiaries get excluded from the system. So, which is why we are also building enough safeguards, which is through grievance resolution systems, that every person who is identified as not to be eligible for a program would be given a chance to appeal.
Okay.
And if that is found eligible, there would be extra steps. And if that is found that the person is eligible, they will have their way back entry into the program. So it is not just excluding people because you have the registry, but ensuring that when you're using the tech right, you're using it responsibly, and your focus is to make sure that it's inclusive and used for the genuine good.
Right. So this is something that y'all are doing in Indonesia.
We are
Do
doing
we
this in Indonesia.
see something like this in
Yes,
India?
already. Like I mean, we are yet to build a unified registry for all the welfare programs, but we do have built registries. For example, MSc has worked and supported AgriStack, which is having the land registry, which has the geo-reference data, and this helps farmers and the governments to identify the farmers along with their lands, and help them roll out the entitlements that farmer has. Our team in Bihar is working on a program called Digital Krishi, Bihar Krishi, which is a digital integrated platform for farmers, largely the small scale farmers. It is going to impact about 14 million small scale farmers. And the objective is that you have a one-stop digital platform for farmers. You come here, you understand the various programs that you're eligible for. You understand how you can build market linkages. You also have advisory and extension support if you have any queries. You have insurances that are available. So as a small-scale farmer, this is bringing the technology is bringing the services at your doorstep, and you have access to everything through a single platform.
So, one thing that, of course, with all of these welfare schemes and programs, and as you mentioned, say, for example, a pregnant woman, she needs to know all the things that she can get in terms of benefits, but getting that information to them, because we consume information very differently from most of Bharat, right?
Sure.
So, how do we build that awareness so that every person in the nation knows that they're eligible for this kind of benefits or help?
Sure. I mean, there are concerted efforts by different center governments, by the state governments and the center government. I was just highlighting the point on convergence. So the idea is that we need to identify people once, we need to understand their needs, and then route the benefits that are available for them, so that they don't have to identify themselves over and over again, and they can automatically be included in such programs. Now, in terms of the work we've done, we've often seen that people do not understand the programs that are available for them. So let's say we were just talking about a pregnant woman who doesn't identify all the programs that she needs. So there are programs that would give her the support that she needs to build nutrients, micronutrients, in terms of iron intakes, in terms of vitamins. There are programs that take care of the baby when she has. Then we have midday meal school program, which is such an important program that builds equity. So these are different programs, but even though they are being targeted, they are not being targeted to the household. They all need to come together at the same time for us to see real outcomes.
Right.
Right? And that would happen when we are able to build convergence. We need to identify, simplify, harmonize the programs, and get them to the person, instead of them having to look at all the time identifying what all they are eligible. And technology, of course, has played and would play an important part in building this awareness and communication.
And women, that's a very important aspect, because again, it's a major area almost everywhere, neglected and for a long time. And now, of course, we are, at least in India and some of the nations, other nations, we're trying to build that inclusiveness which reaches women as well. In terms of, financial agency, like bank accounts, we have a lot of bank accounts now which women own, but many are dormant. So as you were mentioning that, it is one thing to have that, but then how do you make it work? What are the outcomes? So what should we, as a nation, keep in mind now that women do own the bank accounts? How do we give them true financial agency?
Sure. So a lot of it we've already got it right. Like we are speaking about the welfare programs. A lot of programs are now directed to women. They reflect in the bank accounts of women. When we did our work, when MicroSave was working on understanding the state of relief that was provided during COVID-19, almost the 500 million accounts that were opened under Jandan Yojana, 50% of them belong to women. So the relief was transferred in women's bank account.
Right.
There are multiple, we did some work in Bangladesh, which is a program called Primary Education Stipends Program, the which aims at improving the school attendance and the performance of children. This is a conditional program,
Right.
but the money is transferred into the accounts of a woman.
Okay.
And we've seen that the money that they've made good use of it. And we did some work here in India where we studied multiple 7, 8 schemes, identifying how is the direct benefit transfer ecosystem faring for women. And we identified that about 86%, which was a significant majority of women, they did feel that the direct benefit transfers in their accounts have given them some sort of agency in the households.
Right.
They at least know the programs that they will be getting the benefit for. So the system has made it more reliable for them
Reliable. Yeah.
to make their finances, to understand and prepare for risk better. So that is just one part. I'm not saying that direct benefit transfers to every woman is the ultimate solution, but when we talk about agency, this is a multifold. We need to
Absolutely.
look at it in multi dimensions.
Yeah.
So one, of course, is ensuring that after inclusion, we need to see what exactly an agency would be for a woman. The confidence to own and use their bank accounts on their own, to understand the finances, to understand the financial health, and not depend on anyone. I was just mentioning about this work that we did, that MicroSave did in India on 7, 8 direct benefit transfer schemes. And one of the starking findings was that about half of the women we interviewed were kind of chaperoned by someone if they wanted to withdraw their money or if they wanted to make a simple transaction. So that is what we need to change. We
Right.
need to build in enough information agency by way of education and by also linking incentives and ensuring that they understand what exactly would be building financial health.
Right.
So women doing micro businesses, let's say, they need to understand that if they have digital footprint, if they are using their accounts individually, if they have evidence for it, the system would make them eligible to get credit.
Right.
They can get overdrafts, credit, and then that money can be used in their business. A lot of times the information doesn't exist, and the agency doesn't exist,
Yeah.
or the confidence doesn't exist. We have improved significantly, but the way forward from here is to focus on letting women understand what and how they will build financial
Yes.
agency, the importance of financial health. That is what I think is important.
I think, a lot of we are dealing with digital, like data, metrics, all of that. But on ground work, which that there is no replacement, like I remember when we were growing up, and there would be those little workshops which would happen, your village fairs,
Yeah.
or, where you're kind of gathering a few of the villagers, and you're kind of explaining to them what is due to them, why they should do this and why they shouldn't, and what they are eligible for, and kind of explaining and educating. So I think that would obviously, I'm sure, would also be very beneficial. Great. Actually, so, obviously learned a lot, understood a lot about the whole big, humongous welfare delivery system that our nation is running. But some quick questions for you to wrap up this insightful discussion. Because you worked so closely, in your line of work, you're navigating between government corridors and grassroots as well, right? Where the real India is. What is the most persistent myth about welfare delivery in India that you think should be dispelled?
Hmm. I think one immediately comes to my mind that I think should retire now is that a lot of people think that when we talk about welfare, it's just giving money. It's not that. It's ensuring equity in the society. It's ensuring that there's enough productivity in the society. If you give money to a woman who needs nutrition, I mean, about 50% of our women in the age for 15 to 49 are anemic
Yeah,
in
yeah.
and if you make programs that guarantee some nutrition for them, you're not giving a free support, you're building equity in the society. If you're giving midday meal to kids in school, you're building in conditionality so
Yeah,
that there's focus on education, but at the same time kids are not hungry.
yeah.
You're again building equity. So I think this ecosystem should not be just looked at free money being distributed, but it's also adding a lot of equity to those who actually deserve and actually need it. This is making the society be more inclusive. The other thing that I think comes to my mind, we touched upon this earlier also, is ensuring that the success of a program should not just be looked at by the enrollment. We should also look at the sustainability of the programs. A lot of programs are just announced sometimes, but we struggle to make them sustainable.
Yeah.
So focusing on outcomes, long-term outcomes, through our work that we've done at MSc, we focused on building choice safeguards, ensuring that the programs are sustainable. That is what we need to look at.
Yeah. And I think outcomes very important
Yes.
for a nation like ours, because only from outcomes do we learn
Yes.
and we improve, and we have to keep improving, because
Yes.
end of the day, again, we have a massive population. Uh, you also said extremely uncertain world. We did not imagine there would be something like COVID-19, and then it shocked us, right?
Yeah.
But because some of the things were already in place, I think we weathered it at some levels
Yeah.
quite in a very resolute manner. Um, Second quick question: if we are truly making this shift from scale to substance, what is that one metric that we should not obsess over? Because, as we do obsess over data, we do need data, but what do you think is a very hyped metric which we shouldn't obsess
I mean,
over?
I think we just spoke about it. I think it is important that we look at the scale of program in terms of enrollment, but we should just not be celebrating the success of a program just by the enrollment numbers. So the metric through which we look at the programs now need to be more outcome focused. We also need to attach certain indicators as to what are the long-term outcomes that are happening or that are probable out of the program, and measure those and monitor those instead of just looking at sheer numbers.
And better accountability in
Yes.
some sense as
Yes.
well. Okay, great. So, if you had to wrap up our discussion, and I'm asking you the last question, what should be, what would the next chapter of India as a welfare state, what should it look like?
Sure. I think the next chapter should be focused on growth, should be focused on resilience, should be adaptive. So, which is where we don't need to wait for another pandemic to happen to tell us that we need to make our systems more resilient. We need to focus on how can we build in enough safeguards that guarantee people would be able to weather, if at all there are any kinds of economic disaster, or let's say a health disaster.
Yeah.
The kind of weather we have, I mean, we shouldn't be surprised if we have a health disaster coming up next. We need to be prepared. We need to know that if there's enough rainfall or if there's less rainfall, we need to know who are the people who are most vulnerable. The
Yeah.
system should automatically identify them and top up on the existing programs and reach out to them where they are in a timely manner is what is important. And then focusing on equity, I would say.
Yeah.
Like we should focus more on programs that are conditional, that build equity, instead of just delivering benefits, or entitlements rather, I would say. That is something that we need to look at.
And I think India has a great opportunity here. Again, globally, in some of the top most nations, we see them cutting down on welfare, and I think India is a beacon of light. It's an example to a lot of the nations that you still need to have welfare schemes and programs and reaching the right person and the last mile delivery of that. Thank you so much for coming on What India Needs podcast,
Thank you
Arshi.
so much for having me here, Shutapa. It was such a lovely conversation and an important one as well. Thank you so much.
Absolutely. Thank you so much. Thank you for joining us on What India Needs podcast. I hope you enjoyed this conversation. Do like, share, and subscribe to our channel. If you have any comments, leave them below. Thank you and see you next time.